According to the American Cancer Society, breast cancer is the most common cancer among women in this country. Last year alone, it's estimated that more than 200,000 new cases were diagnosed. The good news? That number is markedly lower than in previous years. Part of the success is due to earlier screening and advanced screening methods. As part of our ongoing series on women's health issues, Lorene Cachola brings us the latest on breast cancer prevention and treatment here in the Mid-South.
Christy Rogers is a biology teacher, a wife, and a mother of 3 sons. She's also a breast cancer survivor. Christy has a family history of the disease, so fear of contracting breast cancer was always a concern.
Well, my mother died of cancer when I was young. She had breast cancer. Both of her sisters they're survivors, and they've had breast cancer.
In 2001, Christy's first run-in with breast cancer was caught on a mammogram, and she had a successful lumpectomy. 5 years later, a mammogram and ultrasound showed no sign of breast cancer. But Christy's doctor recommended a genetic test because of Christy's history with cancer. It turns out the test uncovered the presence of a gene mutation, which can cause breast cancer. Information that proved to be life-saving. These advances in screening methods are allowing doctors to detect cancer much earlier than in the past. Unfortunately for patients, it requires travel to multiple locations to participate in numerous tests. But now, thanks to Baptist Women's Hospital, patient care is much more convenient with the Baptist Breast Risk Management Center, a high-risk clinic.
The high-risk clinic is a place where people can go for all-in-one care for breast care if they're high risk, as far as breast screening with imaging, breast screening with physical exam, and also consultation with, my expertise as a genetic counselor is evaluating what are the chances for developing breast cancer.
Currently, there are only a handful of high-risk clinics in the country, and Baptist Hospital has the honor of housing this one. Since the clinic's opening in June 2008, 90 patients, including men, have accessed its services. With advanced testing and treatment technology, such as breast MRI, the clinic is literally one-stop shopping when it comes to caring for patients at high risk for cancer.
This center is something that really helps us individualize healthcare.
Christy's cancer is in remission now, but the risk of it returning is always present. For her, and patients like her, the clinic is a powerful weapon in the battle against breast cancer. For Smart Medicine, I'm Lorene Cachola.